Good morning, everyone. My name is Manoj, and here we go on the Ignite talk on location-based services on COVID-19 pandemic. Here comes the introduction. Like there is a global need for an app to help and contain, mitigate the COVID-19. The app shouldn't support the WHO efforts and be available on a worldwide basis with a minimal information to the user's location and language. The app will provide users an engaging, integrated, accurate, personalized, related information on COVID-19 from trusted, validated sources. The crowdsourced data from app will be shared with WHO with user information. It provides a platform for integration with a variety tools and resources like a safety guidance. Here you can see in the screen, like facts and the questionnaire and the myths and travel guidance and everything. Yeah, here is an interesting thing, like a screening tool for each and everyone. Like this tool will help you assess your symptoms and determine if you are a candidate for a coronavirus disease test. This will ask you to do screening for yourself, and if you're feeling any of these symptoms, experiencing any of these symptoms, and it will directly directly redirect to the nearby medical services. And it also offers guidance on when to seek medical care and what to do in the meantime. And this information is based on disease control guidelines. Yeah, you can also find the latest information on number of global cases, related deaths, and reported to the WHO. And there is a prominent link to donate to the COVID-19 Solidarity Response Fund for WHO. The app has a user interface bringing the facts and tips how to protect yourself during the coronavirus pandemic. Here are a few tips like how it spreads and how you should clean your hands and how you should avoid close contact. And these are news and travel updates, and there is a travel advice where you can find the hotspot areas around your circle. And this is a news feed and with the latest updates and everything. This is a real-time chat where users can also engage in real-time chat with the chat feature. Users can update their information as symptoms change, and these changes are reflected on the map. And you can see here the confirmation of the infected people and deaths of the infected people. Users can update their information as symptoms change and are reflected on the map as shown as red in color, deaths as black in color. Existing technology like Google Maps allows to indicate whether they have diagnosis with COVID or request permission to track historic location data. This app alerts to send the notification to specific of your locations as well as a potential for that could help to diagnose whether your symptoms are matched those COVID-19, provides a visibility into potential local high-risk areas into increase avoidance behaviors, reducing the spread from local testing and treatment facilities. The user will manually enter recent locations visited with the specific individuals that has been closely contact with the limited and particular region. These are the latest news which you can find in the app, like the news are from the trusted sources and everything. Under the version of contact tracing, people would download this one and update their status should they come down with the virus the apps would use a phone's Bluetooth wireless signals to determine if the given user has crossed the path with an infected person. The outcomes would be like this could lead to alert and sent to anyone in close contact with a person who is infected or who
Finish.
later confirms an infection and allows to risk at self quarantine for 14 days of period. Thank you.
I am Suma. I am here to tell about the application of COVID-19. Uh, my application is of tracking the coronavirus, and the main concept is to create awareness of spreading COVID-19 and precautions. My aim is to track the locations and update latest news, reminder, hotspots, and emergency numbers. Um why I am taking this tracking location is tracking user location only if the user relocates from one place to another place. If the user is staying the same place, it's considered as a hometown or some place hometown. Uh, mark sorry Mark the location of the stores and pharmacies and track the people visiting that location and indicate them in color, which is if if the story is full of persons, then consider as the red zone, and if the story is having only some people, consider as yellow, so that people can enter the store easily and stay away from the affected people. This updated latest news is about the to help to help to reduce the spreading fake news and panic about the people. Reminder is about washing the hands, and emergency numbers about in these emergency numbers we include the government numbers. Next, hotspots. Infected area by analyzing online data and creating most infected and average infected and least infected. Future of the app is to track your interaction with someone who could have tested COVID-19 positive through Bluetooth and GPS and Wi-Fi uh, generated by social graphs. It also suggests preventive measures, and it is also available in several languages. Our app needs two sides, two application. One is Healthline and COVID-19 tracker. Uh, potential of this is uh, Potential of our app is communicate critical risk and even information to all communities and counter misinformation. The user will also declare their travel history in the case of doctor asked. Why? Because we are including the health line in the previous slide. So if you contact on doctor in online, we have to give the information about the travel history also. Limitations. Limitation is nothing in our app. We cannot recognize our correct position of the people if the building has many stairs. So I recommend this as a limitation. And another one is the fake newses. We have to filter and we have to add in our app. uh, then next, rationalize means here rational is nothing but the cha- challenge and action. It is nothing but an action. The main action is the social distance. So social distance is in our app. This gives the information of people affected, so that we cannot go out and we cannot get affected by other people who are affected. So my rationale is social distance. Uh, in for our app, the requirement is the mobile which has GPS and Wi-Fi and Bluetooth, and the outputs of this app is how to stay safe and learn more about the COVID-19 and safety measures and precautions. Um, what are the outcomes of the app is we can maintain social distance and take self-assessment test and knowing latest updates. These are the screenshot. We can get any languages. Um, these are the precautions and the self tests. These are the do's and do nots. This is the online charter box for.
Okay, that's all.
Good morning, everyone. My name is Kartikeya. Today I am telling about the COVID-19 mobile application. Uh, this is the introduction page, home page, and the login page to my mobile application. This is the main menu. In this, user can check the local news and worldwide news and worldwide cases and India-wide cases. And he can also check by using the GPS location, and he can also check the hospitals and hotspots also, and he can also check the police station and the nearby groceries and restaurants. This is the first page. This page is a local news page. The user can check the local newses, top newses, and as well as the uh, city-wise and the district-wise, city-wise news also. He can check whether the news is on this or not, and also the updates of the rules in. My application is based on India. I created this based on basis of India. This one is a worldwide news. In this, they can check the worldwide newses of top stories and the newses. In this mobile application, there's an option. He can check the worldwide corona status, how many deaths, how many actives, and how many are recent cases and everything. He can check. This one is a local countrywide in India. Each state has each state uh, cases and deaths are will be shown in this local update. This one is hotspots and hospitals. Using the GPS location and track, he can check the hotspots locations and the quarantine centers and hospitals. They can easily, and they can avoid the hotspot centers if when while they are going outside. uh, this one is a nearest police station. It's like in India, there is a problem that some of the suspects are hiding and they are not going to the quarantine. So if the people they notice some of the suspects, they can inform the police station by using the SOS button in this app. By clicking onto the SOS button, it will goes to the information like this. He can submit it and sends the suspected area and address to the police station. They can come and check onto that suspected area and suspected people. This one is like grocery and restaurants. In India, the most like they are getting a more on grocery and restaurant food. They don't know what time they open the stores and what time they deliver the groceries and the food. By this, restaurant will update the time and time and the delivery time. By this, they can check into the restaurant and they can order, and even the groceries also. Thank you. That's my time.
Hello. One of the word that we always hear in this day is quarantine, right? And government may enforce a quarantine on someone who was exposed to COVID-19 in order to avoid spread of the disease. The question is, how do we show that people keep the command in Thailand? A group of village health volunteer or even police will go door to door to you at not the same time when you just come back to Bangkok to force you to quarantine. This shows that they don't have any cooperate in each sector. For now, with the increased trend of the infected case, many countries try to use smartphone app with location-based features used to track quarantine individuals. This can reduce the work door-to-door of the contact. And Taiwan was well known for quickly and effectively to COVID-19 outbreak track. they control quarantine people by working with 5 major telecom companies with triangulate phone location that offer to digital friends. For Hong Kong, after landing at the airport, they tag citizens by using tracking wristband and not allowed to check in for 14 days. Using the app called Stay Home Safe, the app will detect by Bluetooth, Wi-Fi, and geospatial signal. And most of Hong Kong population take COVID-19 very seriously, and they use the public shaming and social norm play that huge role in the prevention of the spread, just like Korea, where most of where a lot of complaint about embarrassing in infected people private life. You're gonna receive SMS like a woman in 60 years old just test positive. Click link below to the page that she visit before hospitalized. And one of the biggest issues is privacy and trust. Will people download the app? Can we trust the app are accurate? Will they believe that their data will be protected, or will data can become back to hunt them? And to overcome COVID-19 and keep privacy at the same time, contact tracing are already implemented in places like Singapore, where test creator app use of smartphone app to monitor citizen contact with each other. If you export to the infected guy, you will be known more quickly and able to get tests earlier. Don't have to rely on your memory anymore who you have been met, and the app use Bluetooth signal to determine if you are near another user, and the data will keep you anonymous and encrypt with ID and proximity data, which store only on your phone. Only Ministry of Health can decrypt the data if need. The key is no location data is collected. Only who tests positive will be asked to share the data log to MOH to speed up the contact tracing. But because the third-party app is enormous disadvantages, like iPhone user must unlock their phone all the time they move. And now there is a big cooperation between Apple and Google with almost the same concept that the both apps. But advantage is they control the operation system, so they can move. They can build more private and usable technology. For the Chinese government, they tax their citizens by use software that analyze their people data to sort individuals by color code, category in red, yellow, and green, to link their health status on the level of risk of COVID-19. They require to register for the QR code via WeChat or Alipay. You have to show QR scan when you enter or exit some public transport or any building. Who get green health says that at low risk they less restriction on their movement. And about Thailand, we have the app called Mo Chana with many gaps. I see many gaps of this app using the same code color concept. They claim that they use GPS and Bluetooth, but I didn't see any map in here. They said that we are anonymous in this app, but after I installed this app first, they forced me to take a selfie, and it said that good to see where the list area, but I don't see any app. I don't see any map in here. And the problem now in Thailand is the lack of COVID testing, right? So I have idea that we should link the app with high risk affected people can track and check the nearest hospital or clinic have the test kit to keep quarantine and social distancing first. For those who get red color or high risk, they can link to the map and show status of the COVID test available in the hospital, how much they left, and where is the nearest possible from them. And finally, I hope everyone gets safe, and even we have the useless government, and I think everyone can be passed on.
Good morning, everyone. During this COVID-19 pandemic, social distancing is crucial part of preventing. I've been practicing it strictly. A week ago, I want to buy lunch from 7-Eleven. There are so many people there, so I think, oh, it will be impossible to keep the distance. I wait and wait. Still many people just walk around inside. Look at my watch. I've lost over 30 minutes already. So this is my idea. What if I know right now 7-Eleven is crowded or not? What if I know at what time 7-Eleven will be crowded? What if I can plan my schedule ahead of time? Ask about what if and then who will. The big and powerful data conglomerates such as Google or the government. Asking about who will be responsible is a complicated question. Let's look at the data we need. We need people's location, a cloud of people location. And it should be in real time and accurate enough. This narrows down to GPS data from mobile phone. And Google looks like the best candidate. With location data of Android users, surely we can make a density map of people. But please wait. Do we need every square meter on Earth like Google Map did? Of course not, right? We only need the data of our point of interest. In my case, it is 7-Eleven. So what if I can ask Google service to give me the density data of 7-Eleven? What if my Google application keep the record of the density at my point of interest? And my idea is Google Assistant can help me with this. Google Assistant is AI virtual assistant, serves our personal needs, and its interaction is specifically for the owner. All I need is tell our assistant, the POIs. In my case, it is 7-Eleven and grocery shop at AIT. Then assistant will pull density data from Google's database. The data will show just like the card of games in assistant interface. And don't worry, please we only look at the density data. Everybody will be anonymous to each other. So no privacy invaded. Well, it is only a case of user invade other users, not Google invading us. And how about the schedule? My idea is, it is a job of our assistant to keep the record of density and the statistics to us. Then I can plan my visit to 7-Eleven when it is free of people. To this step, do you find my idea convincing? If yes, I beg you stop. And I will show you the location. My idea only rely on GPS data. Then please imagine urban area where 7-Eleven is under 20-floor apartment. Is my idea still possible? Certainly not, right? In this case, we need the help of indoor positioning, such as Bluetooth low energy network, or easiest way is just process the CCTV data, or using laser scanner probe for better privacy. We can count people flow at the front door. With this technology, we can now know the density of urban shops. And we need retailer help also. They might consider broadcast the density in their shop, where their advertising means. In my case, it is 7-Eleven application. And POI concept can also use with 7-Eleven application also. Such as I can now see 7-Eleven within my 5-kilometer range, how the density there is. So at last, I hope everybody maintains social distancing and please stay safe. Thank you.
Hello everyone, today I would like to talk about COVID-19 and mass transit. Now we're facing a brand new pandemic called COVID-19, and that's the reason why we are here, staying at home, discussing about how to prevent it. For the basic rule, we must stay home. However, there's still people.
Hello?
Hello.
Yes, you can continue.
Okay. However, there's still people who can't just stay at home. They need to go out for work. So the thing we must do is these actions. But these actions may not enough. The crucial thing to be worried about is transport system, especially mass transit. This is how Thai government deal with COVID-19. They try to prevent the virus by limiting the number of passengers in every type of public transportation, putting graphic queue everywhere to remind us to keep the distance, and sitting next to people is not allowed. But let's see the feedback here. The passenger should be refilled when the bus have no seats left. It turned out that what they're trying to do didn't work. It's told that the number of the buses is not enough. At the last operation hour, the driver needs to accept those passengers because of the curfew. So all is a waste. Okay, suppose they increase the number of buses and change time schedule to be faster, but they still face the same problem. What should we do? Do you agree that it might be better if we can know whether the approaching bus is empty? For us, we know the empty seats in S1, or it would be even better if we can book the tickets on mobile application and every step is contactless. What can be used to support this idea is location-based service with real-time updating. In Bangkok, we already have this kind of application which is called Viabus. Its function includes showing the list of the available bus line in the area to specific destination and also showing the real-time updates of the bus so we can see the upcoming buses. I would like to propose one kind of function to add in the app in order to solve the problem mentioned earlier, which I name is passenger seat or location function. The main purpose is to update the number of passengers in real time by using NFC. NFC or near field communication enables short-range communication between compatible devices by sending information over radio waves. Our smartphone is considered as an active NFC. NFC we use to pay the fare like Apple Pay or Samsung Pay, but in this case we can pay using via bus application right away. This is a way to prevent the virus because we don't have to exchange cash. And to count the number of passengers and update to the server in real time along with the location of the bus, we need two NFC receivers and one must place at the entrance for people to scan the app and another one placed at the exit. People need to scan one more time so they can get out. Then we can get the real time number of passengers on each bus. It should be noted here that every bus must be mono directional passenger flow, which we never have seen in Thailand. And since we know the number of passengers, we know the number of empty seats, so the booking ticket is available now. User of the application who already registered and want to book need to clarify the starting point and destination, and that's all. What to do next is to wait. You don't have to wait for at the bus stop anymore. Just make sure you arrive before your bus comes. That is an effective way to maintain social distance. And in case of emergency, suppose one of the passengers later found infected, it's become much easier to track back the travel routes of that patient because of NFC with recorded time and location and personal information in the app. However, there are few limitations. First, not everyone uses smartphone, and some may find this too complicated to use. And the application must have enough performance to support the big number of users. Thank you very much.
Okay, good morning everyone. So today I'm talking about the importance, the question of where. Why where is very important? Because everyone is asking where are you now. Actually, these famous singers also have songs asking where are you now. So the answer is very simple. We are working at home these days. So why where is very important with the technology? It is location-based intelligence. Location is very important to take decisions, to avoid, to take decisions. And also it is very simple using our smartphone from current location to other other applications like what is the where is the nearest 7-Eleven, where is the highest hotspot of corona cases in Bangkok, where is what is the best route to go to the Bangkok avoiding other routes. So this kind of questions we can easily find our answer using location and also technology. How we can use this location intelligence to avoid, to mitigate corona epidemic. For this is one application which is used in China. They use face recognition using this device and location identification, also temperature measurement of these people. So they have database and they collect data whether who has the disease. This is not directly avoid the COVID, but I want to apply. I want to use this information to share with you. This is using using the data from European Space Agency. They have find air pollution is reducing over this outbreak. So when this is corona is happening, one good thing happening to world environment. So air pollution is reducing. In future, we can expect lot of health diseases which cause from the aerosols will reduce. So many organizations using data from location based to give the real-time information for the people. So this is Hans Hopkins University application. They track people's data and give real-time information about total confirmed cases, total deaths, which is based on the country, which is based on the hourly data. China and other countries are mostly use location intelligence, especially robots. People, medical staffs, and people who work with the patients are very high risk. So robots like machines which can identify location and people and temperature, and they have very good sensors. So they are good with machine algorithms. So they can treat patients. They can identify who is infected. So robots technology is one of location-based intelligence technology which is using this time. This is showing the detectors. These detectors are have sensors to identify temperature using special rays. So also it has sensors to identify location. Based on this information, people can identify decisions makers of the hospitals, airport, and large mega shopping malls can identify in a crowded places who is the infected person. Taiwan is using electronic fence. Electronic fence is it is a person who is infected or already exposed to infected people. They are advised to stay at home for the quarantine. But if they go out of the home, away from the home, Taiwan government is tracking 55,000 people to identify who is avoiding quarantine. So this is called electronic fence, which is based on also location based. Real time assessed.
Good morning, everyone. I know in this period we are facing COVID-19 pandemic crisis, right? Among this crisis, most people are very concerned about the inflation of COVID-19, including places to go, route, and other information. So location-based service is the one of technologies which is selected to apply to reduce the concern issue. Now there are various applications
which are developed for providing information, news, and notifications to people. And this is one of interesting COVID-19 applications in Thailand. It's called COVID-19. Away COVID-19. It was developed by Mappedia company. The user just only add like official account by this QR code, and this is the overall application in of away COVID-19, and inside this platform can be divided into three main functions. First is warning before approaching the risk area. Just pressing this button and you will immediately know how many cases near your current location, including the state of each case, which is shown in different icon like this. And you can know each case information by place the case button, and you the information will appear, and you can and you can also use to record and check the route when leaving home. These are other information that you can search, such as emergency number, like the right left hand side image. Second function is showing statistic of infected person in Thailand by table, graph, and maps. And the last function is searching hospital or specimen collection laboratory. The place which near your current location are shown, and there are different icons to divide each category of places, such as hospital and pharmacy. You can also search route to go to the place that you want, and just only click the button. It will link to Google Map to navigate you to go there. The users of this application need you allow them to access your data and your location. You might concern about privacy issue, right? But don't worry, because the company will keep your data as a secret and use your data only in this application. Because of the application operation was developed on the Google Cloud, and based on an event inside the geofences, they collect the position data by GPS inside your mobile, connecting Wi-Fi and Bluetooth. So this is why the application can know location of each case and navigate you to the destiny, while the location of place they provide by connecting with Google Map. After you know the overall of this application, you might see many advantages, such as no free, easy to use warning function, and privacy issue. But I think it still have a limitation of warning function, because it will alert you when you only click the button, right? So I think the developer can also use the geofences to detect the infected case for warning when they are going when we are going to closer them in real time by without pressing the button, because the geofences could be dynamically generated as in a radius around point location. Lastly, I hope you have stay safe and have a good health. Take care of yourself. Thank you for your attention.
What is COVID-19? COVID-19 is an infection disease caused by newly discovered coronavirus. Now, COVID-19 has a pandemic around the world. Why the new coronavirus is spreading so quickly and is so difficult to control? Because there are more people who was a so-called super spreader, someone who has yet to show symptoms but is transmitting a lot of infection virus, and they were in close contact with other people. Why the location-based connect with the COVID-19? Many countries use location-based service to find and alert the people who close contact with infected patients by contact tracing to control COVID-19. South Korea, which controls spreading of COVID-19 by use location-based service that use it for infected patient tagging. South Korea tagging individual phone and creating the publicly available map to allow other citizens to check whether they may have crossed paths with any corona patient. Moreover, South Korea government is using into proactively send legion text message warning people they may have come into contact with someone carrying the virus. This the Health Ministry website. There is database of travel log of COVID-19 patients. By use taking individual phone before they were diagnosed with the COVID-19. And then they take the location and turn it into comprehensive digital map. This map generated making of place where from patients have been. The places are color coded to show the leak level. Let's show a virus carrier visited the place in less than 24 hours, thus higher risk of infection. Here I'm shown a sentence so you can see a patient visited Jajongno subway station on March 8th. After places where infected patients visited, the government will send regional text message warning people they may have come into contact with someone carrying the virus. This is the example of the message Korean gave alerts them to the new cases. This procedure that send emergency message to people who may contact with infected patients. It happened after infected patient diagnosed. Access infected patient, government should control people who highly infected, such as people come from abroad or people who highly contact. But some case, people who must quarantine try to get outside their residence. How other people can know that they close contact with them? In my opinion, it can solve by making application. Making application which can alert people who near the people who is highly infected within 2 meters. People can download application and help those allow you to set it up especially people who must quarantine and turn on your Bluetooth. This app help people know that 2 meters allow them have someone who is highly infected. This using wireless Bluetooth technology. This app helps notify more quickly if you're near with people who must quarantine, whether or not you know the person. How does it work? This application Bluetooth signal to determine when your phone is near people who high risk of infection. Phone that also has app collected. If you have near them, this application will alert you. This app should help people quickly know that they near or contact with people at high risk of infection to provide care and prevent the spread of disease. The limitation, there are privacy problems of people from tagging individual phone. Many people are linked to citizen right to privacy and freedom expression. But if without adapt age tagging, there is dangerous. Thank you.
Good morning, Professor and everyone. My name is Sukanya Bunsen. Today I am present in 3 sections. First is what have been done. Second is what's now and what next. For the first point, beginning of COVID-19 is occurred in Wuhan, China. Pandemic start small as a local cluster of new disease. The cluster may grow into the outbreak or even become widespread epidemic. If it spread across the planet, it becomes known as a pandemic. The coronavirus has been declared by WHO. A person can pick up a virus in one place and share it in other location. There is potential to become a super space. The series situation put forward new requirement for the prevention and control strategy for this time. What we are doing now, as a virus spread and people start as panic, experts have created some tools that can useful for update the infection through real-time map application and dashboard, like in the picture that I show in the slide. The big picture anonymized location data point for mobile device. We can zoom in the specific regions. Here we focus specific on just one beat in the months of in the March. The map corresponds to a unique mobile device active a given day. You can see carry device active during 2 weeks straight of early to mid-March, corresponding the spread date. Using we can using QLI to find in this area. We can actually track the movement of this device over remaining week of March, seeing where this device went after they leave the beach, as we zoom in the future. For Thailand, we have developed many things, but it's provided in the province level. The main problem of Thailand is finding infected people, although knowing who they are, but it was unable to find them. Recently, some application is called Moshana application. It can record position automatic. It includes a lot of rich information of ourselves, both from accessing professional information and from the information of interface people as well. Both user input and sensor record create random code. It is anonymous. There is also self-portrait, but the above image will not be uploaded to the server in any way. This application is transparent, clarified. The more commonly used, the more accuracy. Here is a good example of using location-based service. Or it's time for location-based service. Tracking the intersection part of the virus will instrumental is arranging its space. GPS is great, but if they lose the signal, LBS technology can help it. Our virus, what's next? I think in the future it should have thermal infrared camera that like a new normal, like a function in your home. And in the future, I think it should have the privacy that open your location for monitoring, collecting, analyzing.
Yes.
Okay, let's get started. Good morning, everybody. My name is Sasawat. Today, I will present in this topic is indoor location-based survey in healthcare. First, we need hospital staff and administrator face many challenges in delivering care while managing costs. Health information needs and service also vary with location when the data that can also change all of time. Today, hospitals worldwide are actively exploring new ways to create better working environment for their staff and to enhance the experience of patients through the digitalization and adoption of innovative technology. In the indoor space, Being able to automatically locate a device is a bit more challenging. There is no global satellite signal, cell tower signal, and all the precise for positioning and Wi-Fi network tend to move around. There are many problems from hospital worldwide, so they concern to solve problems such as COVID-19, resources in those hospitals, manage social distancing, avoid COVID-19. The main goal of location-based technology for health information service is to allow better presentation of the distribution of healthcare. Personal data delivery require the acquisition of high-quality metadata, service user, their geographical location and their device. The ability to track the location of people and assets in real time and over time give hospital staff to manage assets effectively, tracking safely problem and increase efficiency, thereby reduce costs while improving patient outcome. Location-aware technologies can help by augmenting hospital information system in key areas, patient care, safety, asset management, regulatory compliance, workflow optimization. Indoor Atlas is an interest in every indoor map correct with map creator tool. By Indoor Atlas, they have a detailed collection of not just the foundational magnetic field data, the enable software only super scalable and high accuracy device tracking, but also radio network, altitude and other data which can help provide a rough estimate of location. Magnetic position was inspired by animal wayfinding in nature. Smartphones are similarly able to detect and respond to magnetic field variation in size building. Visual application by Indoor Atlas, they use this app in Prisma Market Store at Finland. From this, he have app in mobile device and then he search by blue dot for look something he want. The app shows his location in that store by magnetic position. The magnetic position accuracy is less than 6 feet. And this app show your location update in real time. Smartphone owner, iOS or Android, can then be accurately located inside retail store, hospitals, malls, airport, and the indoor space. Those patterns can be precisely assigned to a building floor plan. Sarasota Memorial Healthcare System announced a location-based app or SMH Wayfinder that helps people to navigate inside the 1.5 million square feet. This hospital service direction data from patients around the hospital, finding one way to a healthcare facility, particularly for patients with motion impairment. First is mobile device for hospital visitor using their smartphone. The app will show the direction of point. The magnetic sensor collect your positioning data upload to cloud or communication network. And then the cloud network collect data and give position or information to user and provider. Sarasota Memorial Hospital has been recognized consistently as one of the America safest and best service in case of COVID-19. Limitation of mid-sized facility have thousands of mobile devices in continuous motion. Keeping track of their locate is very hard, still found some lacking data. In the future, it is good if you combine the data from hospital and market in one app based on cloud. The hospital staff can adjust the manage patient following social distancing easier. Monitoring for magnetic positioning to solve risk of COVID-19. And this application can show the route to the food market by avoiding the dense area from the cloud data source. And that's all. Thank you.
Good morning, Professor and everyone. I'm Mr. Nayot. I would like to talk about the topic LBS for COVID-19 pandemic 2020. Today, I'm probably listening about many stories from the many people. Then I want to come to listen some reaction in this thesis. The coronavirus is rapidly spreading around the world and more than 2 million people infected in the COVID-19. In Thailand, it has allowed its 2.6 thousand people infected and the post case is 1,639 from this graph. It can show the increased people infected in Thailand. Thailand declared the state of emergency by the refining from living at home and encourage the use of work from home. In the first day, we are really happy work from home, but now I feel I'm so boring. Until I am already mad because I want to exercise. I'm traveling, I'm hang out, helping, and so on. But then LBS can help you. It uses the real-time geodata from the mobile device or smartphone to provide information, entertainment, and security. For example, the consumer can check in the some place, and the business offer the reward price, coupon, or discount to people who check in. The component of the collocation-based service consists of the mobile device, position components, communication network, service data, and the provider. From this slide, I want to show if you can go to the mall near you anytime, how would you feel? You have been to the mall, right? How does AIS detect or to move know that you enter to the mall and send the short message to you? How do they know? By geofencing. And if you bring VR, virtual reality, and geofencing together, you may go to the mall while you are at home using connection and location of department store. The expansion of the first of expansion of geofencing service area to the cover area, especially in the large community area, and import the mall floor plan into the application layer. And the application can use the VR to search of the product from the mall. When the shopper download the application in their mobile, they can use the VR shopping mall from their home. The virtual reality and augmented reality is shopping platform and the powering and experimental e-commerce for the brand retailer, and the HD quality help you experience suit for the fashion, home, and lifestyle. This is shoulder shopping from VR. The target user are the shopper and sales representative and the brand owner. And output is the service from the department store, and the people can shopping is more easier. From the situation, the social distancing is used extensively to reduce infection. The application is one way to support this concept and to create a happiness for those who are at your home a long time. Allow people in the service area and access to the mall application in each mall will have a regular customer in their service area. For the mall level, there is a correlation with the service level, start from the supermarket, supercenter, and the last one is of the department store. The advantages of the application are the people more convenient to shop and can choose the right product more than the online shopping today, and able to stimulate the country economic and to more stable. And the limitation is the rural area or the remote areas the suite are useless often than in the urban area because they require more tools and more support. In conclusion, from the current situation, it is not possible when the COVID-19 will be hearing. If our happiness is shopping, we are shopping will help you stay at home happier. Thank you for attention, everybody.
Okay.